Hi, I understand you're here for a cranial nerve examination today. Okay, great. Now, is this your first time here in this particular clinic? Okay, so since your regular doctor recommended you for this specialty clinic, we don't have any of your files on hand. So if you don't mind, I just have a few questions to ask you. Is that okay? Okay, great. Can we start with your last name, please? Okay, and your first name and middle initial? Okay, now what is your date of birth? And do you know a rough estimate of your height and weight so I can keep that on file? No, well, your regular nurse at the main facility keeps all your exact information, but we just like to have an estimate. Okay. And is that in pounds? Okay. Okay, now we just have a few questions regarding your personal health and your family's health history. So, first of all, do you smoke? No. Okay. Have you ever? Great. Do you drink? Okay. And about how often? Okay. So maybe like twice a week? Fantastic. Do you have a history of any terminal diseases in your family? Okay. And on which side of the family is that? Okay. Now, are you experiencing any pain today? No. Okay. Has anything been providing you any discomfort for the last 6 months that you'd like me to know about? No? Okay. Let's get started then. So there's just a short series of tests I'd like to run with you to gain an overall sense of how well your facial muscles and facial nerves are working at this time. Please let me know if at any point during this exam you feel any pain or discomfort. Okay? Fantastic. Let's get started with the olfactory nerve. Now, have you been experiencing any issues with your sense of smell? No. Okay, then we're just going to be doing a very rough examination of your olfactory nerve. First, I'd like you to take your finger and cover up your right nostril, please. Or just either one. Okay. Okay, we'll just start with your right side over here. Can you take a breath in? Perfect. Okay. And can you cover up the other side, please? Inhale. And what did you smell? Perfect. Okay. So that was just fine. Did they both smell equally as strong? Perfect. Okay, so now I'm going to be testing your visual fields. I'm going to be wiggling a finger back and forth on either side of your face, either side of my face, excuse me, and I just want you to tell me which side you see it on, and I want you to stare at my nose, okay? Perfect. Very good. Great, okay. Now I'm going to be testing your fundoscopy, which means I'm going to be looking into the back of your eye for your eye health, and I'm just going to be using a light which is going to shine right into the very back of your eye. So I just want you to stare at the light for me and do some very basic eye movements for me, okay? Okay. So I apologize for how uncomfortable this might be. Okay, just stare into the light. Okay, can you look up for me? And to the right, to the left, and down. Okay. Again, do the very same thing, just stare into the light. Okay, can you look up for me? And to the left, to the right, and down. Okay, great. Now going to be testing your pupillary light reflex, which means I'm going to just bring the light in quickly and then move it away from your eye so that I can see how your pupils react to the brightness of the light, okay? Okay. So first we're going to test your left side. Okay. And the other side. Now we're going to be testing your oculomotor, which is going to be your extraocular movements, which is measuring your pupil size, shape, and I'm going to note if there's any asymmetry. Okay, so I'm going to hold the light out, and I'm going to want you to follow it in the shape that I'm going to be drawing, okay? Now we're going to be testing your trigeminal nerve. This is going to be the longest part of the test, so just bear with me. Okay, so I'm going to take a cotton pad that we used earlier, and I'm going to be touching different places on your face very lightly, and I'd like you to tell me when and where I touch. Okay, so just close your eyes for me. Now where was that? Okay. And where did you feel that? Great. And where did you feel that? Perfect. And where was that one? Okay, great. Now I'm going to be using a sharper object just to do the exact same thing. And I want you to tell me if you can feel the difference, first of all, in the cotton pad to the sharper object. And then I'd like you to tell me when and where I poke you, okay? Okay, close your eyes again. And did you feel the difference? And where was that? Great. Very good. And where was that one? Great. Okay. Now I'm going to ask you to turn your head in different directions, and I'm going to be using pressure from my hand to try and force you to look the other way, okay? So first of all, I'd like you to turn your head to the left and try and look to the right. Okay. Perfect. Now I'd like you to try and force against my hand on the other side. Okay. And now I'd like you to look up for me and try and look down. Perfect. And look down. And try and look up. Okay. Perfect. Now I am going to test your jaw jerk reflex, which is going to be me placing my finger on top of your chin and tapping it with another finger. And I'd like you to hold your mouth open lightly. Okay. And I'm going to tap it and see if it reflexes in the way that it should. Okay. Perfect. Okay, now I'm going to test your facial movements, which are just very basic daily actions that you should have no problem doing. Okay. So first, I'm going to have you smile with your lips closed for me. Okay, and with your teeth. Okay, and keep smiling. I just want to feel your upper cheek muscles. Okay, you can relax. And now I'm going to have you frown for me. Okay, I want to feel your forehead. Okay, the lines formed as they should. And now I'm going to ask you to raise your eyebrows. Okay, can you feel the lines on your forehead again? Okay, perfect. And I'm going to ask you to close your eyes very tightly. Okay, and keep them closed and don't let me get them open, okay? Very nice. Now, could you puff out your cheeks? Great. Now, the last part of the facial movement is actually not a facial movement, but it's me testing your taste, your sense of taste. Now I'm going to be using the same smells as earlier, and I want you to hold out your tongue. I'm going to place this cotton pad on your tongue with the same thing. I promise it is non-toxic, and it is made for the purpose of this examination. Okay, so just hold out your tongue for me. Just hold it like that. Okay. Can you tell me what that was? Perfect, just like earlier. There you go. And can you tell me what that was? Perfect. Okay, now I'm going to be testing your sense of hearing, your vestibulocochlear nerve. And I'm going to be holding my arms out to either side of you, and I'm going to bring them in slowly, and I'm going to be making a small noise with my fingers, and I'd like you to tell me when you can hear it, okay? Okay. Okay, perfect. We're going to do it one more time, okay? I'm going to start from the top. Okay, now I would normally test your gag reflex at this time, but I'm not going to do that because I feel like that would make you a little bit uncomfortable. You're welcome. Okay, now I'm going to be testing your accessory nerve. So I'd like you to turn your head slowly to either side. Okay, and I'd like you to shrug your shoulders. Okay, and do it one more time for me. And was there any pain in any of those movements? Did you feel strained? No. Okay, so your last portion of this examination is going to be your hypoglossal nerve, which is the examination of your tongue. So if you could just hold it out for me, I'm going to inspect it for any atrophy, any asymmetry, or infection. Okay, so just hold it out for me. And can you lift it up for me to the roof of your mouth? Okay. Now I didn't see anything wrong with any of the examinations today, so I'm just going to make a couple notes about that. Okay. Was there any point during this examination that you felt uncomfortable or that anything felt any more strange than it should have? Okay. Yeah. So you've been having headaches, right? Do you feel like it has anything to do with your eye health, or do you feel like it is because of the allergies this season? Okay, well, if you'd like, I can recommend you at the front desk outside with the receptionist. I can recommend you to an eye doctor right away. Fantastic. Okay, well, if you go out there, my receptionist will help you get that all set up, and you'll be good to go. Thank you so much for coming in today, and I hope you have a great